Thank you very much. I'm director and general manager of New Beginnings, and it's a company that provides high-quality supplements for children with autism, and we provide those supplements worldwide. And it's fun for me, after being what I've been through with my own son, to be able to be in the field and still working and helping parents and working with physicians and distributors worldwide to get quality products into their hands and to help these kids. And of all the things I do, this is my favorite, speaking to parents. Because I was a parent in a conference for the very first time with a 2-year-old that was just diagnosed with autism. And I remember what it was like. And it's overwhelming. And I remember getting help and advice along the way. What do I do with my child? What can I expect? How can I help them? And being able to do that and to share my success and to encourage you to do the things that might make a huge difference for your child, or if you're a professional, for your clients, is the best. Nobody could have a better job than that. So I'm thankful that you came and to hear this today. And I'm going to go through what I consider some of the most important things that have made a difference in my son's recovery. And the purpose of this is not just to talk about Daniel, but to educate you on what is important to do if you want to help your child to be the best that they possibly can be. Daniel was my number 4 child, and we joke about this a lot. He was my surprise baby. I wasn't expecting Daniel, but God knew that Daniel was supposed to be, because Daniel changed my life. We found out at the 2.5 that he was diagnosed with autism, and I just remember my life just falling around me, just being thought that couldn't believe that this was happening to me. And I took that severe grief and I turned it into intense pursuit of knowledge to find out what I could do. The traditional doctors didn't have much for me. I was going to figure out what I could do to help make him well. And so I was that person who had to become the advocate for my son. And it took me 4 years. So this is not a sprint. This is a marathon. So when you start this lifelong journey of helping your child, you realize it's not going to happen fast. It's slow. So after 4 years, at the age of 6.5, I finally realized, oh my gosh, when they came to me and they said, he doesn't need an IEP anymore. He's met all his goals. And I'm like, don't take away my IEP. But then I realized that's okay. It's all right. That's a good thing. You know, I can embrace that. Daniel, this has only been the second time. I speak all over the world. I've spoken so many times, but he never really gets to be. We are from Kansas City. My New Beginnings is here in Kansas City, and we live just 20 minutes away. So he's here today, and so thankful that he said yes. You know, Mom, I'll come and do this with you. So you'll get a chance to talk to him and hear him speak, and I'd like for you to ask him some questions. And we have not practiced anything. All of this is completely off the cuff, so just be aware of that. This is my baby, age 3, age 16. You could see the difference between the before and after. The little boy on the left has a very lost look in his eyes, and you can see how severe the autism is by looking at the eyes. And you look at the kid on the right, and he's all there, 100% there. Now I'm going to show you a video that ends in a 12-year-old giving a testimony of how he's doing. And I give that to show you that he truly has recovered, because people look at me and go, no, it's impossible. Children with autism don't recover. And you can't possibly have a child recovered with autism. I'm not going to show you that, because you see the real deal here at 16. And I want to save the time for those types of questions. So I just want to let you know I'm only going to do the first part here. And we're going to go ahead and show that video so you can see how he was in the beginning. And one of the things I want to tell you, if you have a child that you haven't started biomedical treatments for, make sure you videotape how they are, because so many times we don't do that. We don't like to get out the camera and videotape them at their worst, but when they get better, you'll wish you had it to compare to. So if you haven't videotaped them at their worst, do that, because this was tough for me to find.
Give it to Katie. Can you see him?
Yep, I can.
I'm gonna get off. I'm just gonna go on this side. Give it to Katie. One's for me. I'm gonna feed baby. Daniel's turn. Daniel's turn. Feed baby.
One of his problems was prolific drooling. He drooled all the time.
Daniel's turn.
Is the baby going to get a Tubbies? Give the baby Tubbies.
There she is. Can you help? No. You take her out? You take her out?
Daniel, wipe a chin.
Daniel.
Daniel got wet chin. Could
Wipe your chin.
Could you wipe a chin?
You take baby out. My name is Katie Corman. I'm a speech and language pathologist. I've been working in the pediatric population for about 7 years. I met Daniel in July of 2000 when I did an initial evaluation. He presented with some significant receptive and expressive language delays in what he understood and what he was saying, and also his play skills. At the time, he was using some simple one-word phrases. He was following directions only if you were giving him lots of visual cueing, telling him where to go using lots of visuals. His play skills were really far behind in that he would only put blocks into a container, lift them up, dump them out on himself. Very repetitive. When you tried to enter his playing world, he had a meltdown, a tantrum. He didn't understand what you were doing. He thought you were taking everything from him. He would become very possessive, grabbing onto them. It was very distressful for him. We began intervention twice weekly in his home for hour sessions, along with, there was some occupational therapy and special instruction. In September of the same year of 2000, his family began some drastic dietary intervention, and we began to see some really nice improvements with Daniel. He began to expand his word length, his utterances. He began to follow some directions without cues. It was probably the most significant at least a month into using some dietary intervention, but it became so rapid, his progress with his play skills and his comprehension, that his goals changed almost weekly because he was gaining so much language so quickly. He was beginning to greet people spontaneously. He was attending to his environment. He was responding to sounds in another room. He began commenting on play. He was engaging with others, eye contact, excited about activities. His receptive language, he no longer required the dramatic visual cueing. I strongly, and I believe wholeheartedly, that he made progress not only because he really benefited from one-on-one intervention and some strong sensory integration input, but also the dietary intervention. I by all means don't think that his progress would have been as great without the dietary intervention that the family was doing.
Okay, so we're going to skip the other part. Here he is at 18 months, glassy-eyed. This is what I call my opiate-addicted son, the child who's consuming lots of wheat and dairy, and we don't know why he looks like that, but that is why. Second birthday, not aware of what is going on. Had to hold the candle up to his face for him to see it, and he was not capable of blowing it out. 28 months with a goat in his face and could care less, where that is not a normal thing for a child that age. Late to crawl, late to walk, slow to speak, 15-month vaccination, started losing words. Other warning signs. all of these are familiar to you. Every child with autism looks different, but very low muscle tone kid, didn't move around very much. Unexplained crying spells that went away after we took him off of wheat and dairy. All he wanted to do was watch Blue's Clues, Thomas the Train, Teletubbies, you know, all of those ones that drive you absolutely crazy over and over and over again. Remember those videos, Daniel? Okay, journey to wellness. We started getting speech and occupational therapy would come into the home, and that lady that spoke is the one that changed my life, because I started hearing weird comments from people randomly when they found out what I was worried about Daniel, what was wrong with him, and I thought maybe it might be autism, but we were still waiting to get a diagnosis because they never take you in right away on that. She handed me Dr. Shaw's book and said, I bought this. I have a couple clients that I'm working with who are doing this type of treatments, and here it is. And she left it with me, and it took me a while to pick it up, but once I did, it changed my life because it showed me all the things medically wrong that could be causing my child to have autistic symptoms. And when I learned about what all those medical things going on, and that there were treatments to help reduce those symptoms or to make those medical conditions go away, that my child's autistic symptoms would improve. And so once I got a vision of that, and I started educating myself by coming to conferences, by reading, I was online all the time, on email, chat groups, you know, listservs, I started getting the education that I needed so I could be that advocate for my child. I found a physician that was willing to order the right kind of testing, that knew what I was doing. Pediatricians, regular doctors out there, they don't know this stuff. All right, and they aren't trained in nutrition. They don't believe it. Some of them will tell you they don't know anything. Others will say it's wrong, but they are just not the kind of doctors to go to because they've not been trained this way in medical school. And luckily there's some open-minded ones, but the ones you need to find are the ones who have really looked into it and know how to treat these underlying issues for autism. Lab testing was huge for me. That was my aha moment. When I got those lab tests and I looked at them and I saw all the abnormal levels, all the horrific gut bacteria that was in his gut, all the high levels of yeast, you know, the abnormal markers, and I went, something is wrong with my child. And you can sit down and cry with that, or you can say, I have a roadmap now. I know what to do to make my child well. This tells me what's wrong, and I can find out how to make them better. And that was the beauty of lab testing. Otherwise, you're just shooting in the dark. Lab testing will tell you what the most significant problems your child has, so you can go after those first and get them well as soon as possible. Diet, all right? There's lots of things that can be contributing to autism. Food is a big one, and this is the hardest one for parents to swallow, to be honest with you, and there's lots of reasons why this is difficult, but you heard it on the video, all right? Unbelievable changes in language, and there's lots of reasons for that, and I want you to understand the difference and what's going on here. This is what I thought when someone was telling me, I took my child off of wheat and milk and they started talking. I thought, how can that be? All I've been told is that wheat and dairy are the two foods that are, you know, good you're supposed to give your kid. Give your kid 3 or 4 glasses of milk a day. That made me a good mom, right? You know, I have to get that milk down my child. How could it be bad? And there's a reason for it. And this is the opiate peptide theory. And what the problem is that the digestion of our children is impaired. And casein is a major protein in milk, and gluten is the major protein in wheat. And these proteins are made up of smaller molecules called amino acids. And picture a strand of pearls, okay? These are each individual amino acid in a particular form that are making up gluten or casein. And with abnormal digestion, your enzymes in your mouth and in your stomach are supposed to break down these proteins into that point where all those individual pearls or beads are cleaved apart. Well, with our kids, for some reason, that's not happening, and they're partially digested proteins that are getting into through the digestive tract into the bloodstream, and they actually are becoming something called gliadorphin and casomorphin. And does that remind you of anything? Has anybody ever had morphine ever? I had 4 C-sections. I know all about morphine. And morphine, when I'm on morphine, guess what? Guess how aware I am, all right? I remember my husband had to feed my baby with a bottle because I was so out of it. I couldn't even nurse, okay? Morphine did that to me. This is what these foods do to a significant percentage, and we're talking at least 75%, are walking little drug addicts is what it is. And so why do you think they want only milk or only wheat products or a combination of both? It's because it makes them feel good, all right? And it's an addictive thing. I used to wonder why my son would wake up from a nap or from an overnight sleep and he'd be crying hysterically in the morning. And I'd be going, well, my other babies woke up happy in the morning and he's miserable. Why is that? Well, once I got him off of this addictive continuum, he became a happy little guy because he was needing a fix, and it made sense to me. So studies have shown that levels are higher of these opiates in autism, and this opiate, there's opiate receptors in our body. Some of that are in the brain, and guess where they are in the brain? In the speech and language area. That's why the kids aren't talking. That's why the kids aren't understanding what's going on. All right, so when you stop feeding those foods, they break free, and all of a sudden, their communication will open up. Again, there are kids that have other issues where this may not be the magic pill for that, but a lot of kids start talking better when this happens, when you remove these foods. And also, there's opiate receptors in the gut. My child, chronic constipation. Painkillers, opiates will constipate you. So as soon as you remove those foods and those opiates move out of the body, chronic constipation, which is a bad thing. I mean, really messes them up, and it affects their brain, it affects their behavior. You really need to get rid of that. And so once I stopped those foods, the constipation went away, and that was something I wasn't expecting. So what are some of the signs that your child might need the GFCF diet? Or if you're working as a professional with children, spaced out effect. I already talked about that. High pain tolerance is another one. You see a kid smack his head and get up like nothing's wrong, and mommy and daddy go, oh, little Johnny's such a tough boy. No, little Johnny doesn't feel the pain. And we're supposed to feel pain. That's a good thing. But again, my son really benefited from the diet, but he didn't have high pain tolerance. So if I looked at this and went, oh, my son has high pain tolerance, I don't need the diet, I would have missed out. So your child doesn't have to have all of these things to need the gluten, casein-free diet, but any combination of them, 2 of them or 3 of them would be enough to really make you think about it. Limited food choices. All they want are those foods. And then I talked about the other thing about it affecting speech and brain function. So how do you do the diet? Well, the biggest thing is the parent, and I'm sure many of you out there are feeling this way. My child eats 4 things. And all those 4 things are either wheat or dairy. So if I take out those 4 things, my child will starve to death. All right, you're all thinking that, right? I know that. And I thought that too. Scared me to death. Okay. The reality is, it's hard at first. You give them choices. You find substitutes. There's a lot of good substitutes out there, much more variety than when I was going through this with him. You find substitute and you offer them choices. You say you can have this or this. It gives them some control, and they may turn it down for a while. You be tough, because I told myself these foods are poison to my child. I can't continue with a clear conscience to give them these foods. And so he eventually, out of hunger, keep him well hydrated, out of hunger, started eating them. And eventually, when all the addictive issues dissipated, he started eating more foods and more variety of foods, and better than he ever had, because his food choices were not for an addictive, because he was an addict to them. All right, is there anybody, if you are a parent in this room who has put your kid on gluten, casein-free diet and thought your kid would starve, but found out that in the end that they ate better in the long run, would you raise your hand? Okay, so those of you who are skeptics, look around. They do, it does work. They eat better in the long run, okay? It's very important to get an IgG food allergy test, before you do this, but you want to start finding substitutes. So you say, I'm not going to give him wheat, so I'm going to give him rice, or I'm going to give him corn. What if your child has an immune response to that food that you are replacing? So before you go out and choose a milk substitute, almond milk, rice milk, coconut milk, you need to find out what other allergies are out there. And we're not talking the histamine allergy that the skin test does, where there's an immediate reaction. You eat a strawberry and your throat gets tight, or you need an EpiPen, or you break out in rashes. That's not the kind of allergy we're talking about. We're talking about an IgG allergy, which is an immune response, but it's delayed. And it's mostly happening within the intestinal tract. And it doesn't cause that histamine response, and you don't know about it because it cannot, whatever the behavior or whatever the issue it's causing for your child, it may not happen for hours or even days after consumption of the food. That's why a test is critical for that. And Great Plains Lab does a really good test for that, and it's really not very expensive, and it's worthwhile because your child's not going to get better until you heal the gut, and the gut is not going to get healed until you remove the foods that are causing inflammation. And that's what IgG allergies do. They cause inflammation, and they will cause behaviors in your child that you think are autism, but it's not. It's that potato or it's that corn that you're feeding the child. And I noticed that when I did the IgG allergies, that my child also was off the chart for wheat and dairy. So there's the ability to be immune reacting to the wheat and dairy, and there's also the digesting issue. They're two different things. So just because your child is fine for wheat or dairy or one or the other, they still may not be digesting it, and you still could have that opiate effect. They're two different things, but they're both very important, and you need to take into consideration. Start gradually. Sometimes that's better. I went cold turkey, and that was really stressful. Research. Start gradually. It's easier on them, and they don't go into that withdrawal that you see with drug addicts when they start feeling sick. Start with replacing favorite foods. Offer different choices. Be prepared for withdrawal symptoms. Soy also has an opiate causing capacity, so please avoid soy as a choice. Look at hidden ingredients. Watch for cross-contamination. It gets easier with time, and be determined. Give it at least 4 months before you decide to quit. Because if you give it 4 months and you see absolutely no improvement in your child, you can say, my kid is one of the 20% that doesn't benefit from this. And you can feel good that you did that, and you can move on to the next treatment or whatever that you want to try to help your child. So the IgG versus IgE allergies, the IgE is traditional. We talked about the IgG is delayed. You've got that the anosic, the kids that do that allergic nose rub. You have eye circles of signs of that. The red ears, the red cheeks, eye wrinkles under the eyes, aggressive behavior, lack of alertness, and mottled tongue are all symptoms of IgG food allergies. This is the test. As you can see, it's really simple. You won't need a brain surgeon to diagnose it for you. The allergies that are way far to the right, that go into the third and the fourth columns, are the ones that you need to take out completely out of your child's diet. The ones that are in the one category probably are okay. They're not allergic enough that's going to be causing a problem. The twos I would be wary of. If you give it only every once in a while. And when you take out these foods and you take them out of the diet, and if you introduce them again after taking them out for 2 weeks, you will usually see a very strong reaction because it's been out of the system. And that's a good way to test these ones and twos to make sure that your child is okay with keeping them in the diet. So other things that we did for him, dietary changes. My son had a lot of yeast. I'm going to talk a little bit about yeast, but he had a lot of yeast issues, and so we had to avoid sugar because sugar feeds yeast, and carbohydrates turn into sugar, and that feeds yeast. So we had to go very low. He used to drink apple juice straight. I thought that was fine. He would walk around with a bottle of apple juice. Then I realized that was not a good thing for him, and I needed to start making him drink more water and less fruit juice. Fruit juice will feed yeast like nothing else. So I ended up watering it down and putting just a tiny little bit of juice, mostly water, and I would do a couple drops of stevia, which doesn't feed you, sweetens it a little bit, because he was one of those kids who would not drink water. Still won't drink water today. So anyway, that's something I hadn't done so well at. So we avoided processed food, tried to buy organic whenever possible. We tried to get purified water, and we avoided seafood. Tuna has high mercury. One thing we know about our kids is that they don't detox well, so trying to avoid toxins and chemicals is a good idea because it helps their body to heal instead of fighting all of these chemicals. So his progress on the diet: marked improvement with both receptive and expressive language. His spaced out affect was gone. Crying spells eliminated. He became more aware of others. He was more effective in his therapy. Okay, we found out, did you hear that speech therapist say he was making so much progress that his goals changed weekly? What speech therapist wouldn't love that with a child? And until we did the diet, that was not happening. We were making little bitty things. Sometimes he would lose it, but he started. So whatever you're doing, whether it's ABA, speech therapy, you know, any type of therapy you're doing, it's going to work so much better and so much faster when you get all this junk out of their brains, out of their body. You take away the bad and you put in the good. You're going to find your child making more progress. And this seems so hard, but once you see what it does, it really is worth it. And it gets easier with time because you learn what to buy, what to make. And, you know, even Daniel, when he, again, Daniel is not on the diet anymore. We did the diet for 9 years, and I would make our own pizza with gluten-free crust and, you know, dairy-free cheese. And I would bring, whenever there was a pizza party, I would bring his pizza. I would bring his cookie to school. I would let the preschool teacher have a bin of snacks that were acceptable for him. And you just figure out how to do it, you know, and it gets easier with time. It gets harder when they get into middle school and then they start, especially if they get to be really high functioning and doing well, then it's harder because of the peer pressure. But when they're young, it's a lot easier. But what I tell with parents with older kids is to get them involved. And if they're willing to buy into it, sometimes these kids realize they feel so much better that they do it themselves because they know that I am so much happier with who I am and how I act and how I feel when I'm eating the right food. So older kids can do it too, but normally you have to get their buy-in in order to be successful. He became more interested. His constipation disappeared. This is something I wouldn't expect. It's sensory issues. The sensory issues, which are such a big deal, they disappeared too over time. And the other thing that really shocked me is that he had chronic sinus infections and chronic asthma starting at 10 months of age. We were doing the breathing treatments and the prednisone. He was sick a lot, and I had no idea that it was related. And did you know that milk allergy is related to sinus infections? It's related to allergy, to asthma. It's also related to chronic ear infections. So when you remove these foods, you may see medical issues that you've been fighting disappear. He has after taking him off of these foods, he never had another asthma attack and never had another sinus infection. So there was many benefits from this. Then I did something really stupid one day. I bought the wrong kind of waffles, and I went to the grocery store and I picked the wrong kind, didn't notice it, and he would eat waffles in the morning, and I thought they were gluten-free. And I gave him gluten waffles, and I saw my little boy, who was coming back to me, disappear right before my eyes. And we were all going, what's wrong with him? Look what he's doing. He's doing what he used to do. And I just remember going, oh my gosh, what's happening? And I found out that I gave him the wrong waffles. And it made me feel like such an awful mom. But it really did tell me that I was doing the right thing, that this was the reason. There was no other reason he was getting better besides the diet. So I never made that mistake again, but it made me more determined to stick with it and to keep going with it. This was our most dramatic intervention. Okay, nutritional supplements. Went to go find a doctor who knew about autism. First thing she did is she looked at him and she did all this analysis on him, did some labs, and she goes, you need to put him on these 15 to 20 supplements. And I went, what? You're kidding me. This is too much. He goes, yeah, you got to do this. If you want them to get better, give them one at a time, every 3 or 4 days. And I thought, okay, because I knew Daniel was full of heavy metals, and I was online talking to other moms, and a lot of moms are doing chelation, and chelation scared the heck out of me. And I really took me 6 months of studying before I was strong enough to try it. And I decided to go with this method that is really low and slow, and it was really safe, and I decided to do that. So I went to a doctor, and she goes, you can't do chelation until you get him on all these supplements. And he was on some, but not everything. So she told me all these supplements to give, and I was completely shocked seeing his improvement after adding each supplement. I wasn't expecting any improvements, but he started getting better cognitively, behaviorally. His sleep was better. You know, he was less moody. He was more aware. And I thought, whoa, this really surprised me that this would work, that this would be such a dramatic intervention. But it was for him, and it can be for a lot of kids. Why do we need to give supplements to our kids? Well, there's a lot of deficiencies due to diet. Not only do we restrict their diet, they restrict their diet themselves. They have malabsorption issues due to inadequate digestive enzymes. They have abnormal flora, which is critical for the digestion process. They need to have higher than normal recommended amounts due to biochemical errors of metabolism. So we know through the research that they need more B6 and B vitamins, that they need a special kind of folic acid, that there's more levels of high vitamin C and antioxidants. We know that these kids are really low in vitamin D. There's a lot of things we know about autism, and these children need more amounts of them than the typical child would. Supplements help them detoxify the chemicals that they have a problem getting rid of. It prevents their oxidative stress, and it just contributes to their overall health. The most important vitamins that you need, supplements, are the vitamins, the B complex, the minerals, magnesium, calcium, and zinc. Antioxidants, high levels are needed. Vitamin C is a cheap one that can make such a difference with hyperactivity. Oftentimes, essential fatty acid, omega-3 fatty acids are good for brain health and eye contact and concentration and focus. Probiotics is good for healing their intestinal tract, and digestive enzymes are also important for helping them digest their food. So things that you need to consider when finding a multivitamin for your child. It should have adequate amounts of antioxidants and also B vitamins and minerals. You should not be giving a multivitamin with copper, because most of these kids have too high copper levels, and even just a little bit of too much copper can be toxic for the child and cause problems. You need to, cod liver oil is a good one. Cod liver oil has a natural vitamin A in it, which is really good for their brain processing and their visual processing. So be aware of vitamin A levels in combination with the cod liver oil. Be aware that some of the stuff like the Flintstone vitamins out there has a lot of bad things in them, artificial colors, artificial flavoring. A lot of these vitamins have gluten and casein in them. So you want to give them something that's clean, that's not mixed with stuff that's going to harm them or give them reactions. You need to make sure that you're giving pure vitamins, because some minerals out there can contain lead. And the last thing we want to do is to put lead in our children, because they hang on to these heavy metals like sponges, and they don't excrete them like they should. So we have to be protecting of them and be careful of what we put in their bodies. And specialized multivitamins, and there are some out there, are the best for our kids. Other important supplements: digestive enzymes, calcium and magnesium, especially calcium when you're taking away dairy. Vitamin D3, melatonin, if they're not falling asleep at night, can be a miracle for a lot of parents. For hyperactivity and anxiety, there's GABA, 5-HTP, L-theanine, and inositol. Methyl B12 can be given in an injectable, nasal, and also sublingual form. And that's a special kind of B12 that can really make a difference for many of our kids. And probiotics, which are good bacteria to heal the gut. And that's very important. So the last thing about supplements is they're not medications, and they are completely safe when taken as directed. nutritional supplements, again, are only one piece of the autism puzzle. The diet is a piece, supplements are a piece. There's other things going on with your child, so it's not going to cure your child by itself, but your child will benefit from it. So it needs to be seen as important. And again, be careful to buy only quality, and testing will show what supplements your child will need in addition to the basics. Try one at a time every 3 or 4 days. Some children are sensitive and they need to start low and go slow. Daniel's immune system got stronger. Cod liver oil helped him eliminate the side glancing that he used to do. He used to look out of the side of his eyes, the periphery glancing. A lot of kids do this with autism. That's a vitamin A deficiency. Cod liver oil took that away completely. He became more calm and focused. His cognition improved. He became gaining weight. He never, some kids may have a problem with getting heavy. Daniel looked like a concentration camp victim. He could never gain weight, and he wasn't digesting his food. So once we added digestive enzymes in, he looked healthier, his skin color got better, he started gaining weight. It was a huge intervention for us, and we did enzymes for a long time. And then also supplements will help with the better yeast and bacteria control in the gut, and overall gave him better health. So make sure that you start with a supplement regime that includes cod liver oil, bees, zinc, adequate minerals, no copper, and some of the special forms of B12 and folic acid that are very important and our kids absorb and utilize much better. Okay, one of the suggestions for a starter package is something that we carry that has all the basics in it. It's called the Spectrumate Starter Package, and it's designed for autism to do the basics, to get those basic levels for feeding their brain. And we have quite a few patients and clients on this that do real well with it. And then quickly, and I'm going to move along fast so we have time, I want to talk about the yeast and the bacteria issue. The organic acid test was really useful, and they have quite a few markers on there that show yeast and bacteria. And Daniel had problems with that. Not only did he have problems with yeast markers, which are here, but he had a Clostridia, high levels of Clostridia that we had to deal with. And then we did a stool analysis that also looked at many things, including inflammation in the intestine, whether or not there were fibers, undigested food particles. Also looked at levels of good and bad bacteria, and they actually culture it, and then they tell you what things to give for your child that will actually kill that particular strain of bacteria and yeast. This is very useful. You're not just shooting in the dark. You're giving what you know will kill it, because they do a sensitivity test in a petri dish with whatever it is they found in your child's stool. Very useful test, and I love this test, and this really helps show me how bad my child's gut was and what I needed to do for it. Some of the signs of yeast and bacteria overgrowth is impaired cognitive function, carbohydrate intolerance, abdominal distension, like you see with this little boy, food allergies. You do a food allergy test and it's high with a lot of different foods. That's probably because you have yeast, because it causes holes in the intestinal tract, which the food escapes through, and then the immune system reacts. Hypoglycemia is another one. If your child falls apart between meals, has to eat frequently, that's because the yeast in your child's intestinal tract is competing with the food supply that they're eating. And so there's not enough of it left over for them, and so they have hypoglycemic symptoms. He suffered with that. That was always a sign that his yeast was bad. Behavioral abnormalities, sleep disturbances, inappropriate laughing. That's definitely yeast. Increased intestinal gas, and a lot of time waking up in the middle of the night, and they just start having a little party at night, and they're all happy and they're giggling to themselves. That's usually a sign of yeast. How do you control it? Well, you take stuff to kill it. That's important, whether it's prescription or non-prescription. There's non-prescription stuff out there that work great. You have to control their sugar intake. You can't feed something and want to kill it at the same time. So you have to limit its food supply. And so all the little sweet things that you give them are making it hard for the yeast to die and to go away. So that's important to modify their diet that way. It's not always easy. So you get the tests, and then you ask yourself, what part of my child's behaviors, autistic symptoms, are caused by yeast? Treat it aggressively, maybe with some of the prescription stuff that your doctor may give you. Evaluate the changes in your child. Then figure out what it is that your child's yeast systems are like. Once you finish treating, follow up with aggressive probiotic therapy. Make sure you remove a lot of the sugars and carbs, and then rotate antifungals every 5 to 7 days to keep under control. But I could always tell when my son's yeast was coming back. This is not something that you treat once and it goes away, unfortunately. The body's immune system is not attacking it and get rid of it like it should be. And so it's something you have to keep on top of. It took me probably 4 to 5 years to finally get on top of his yeast. I had to always be aware of it. I had to always be treating it. But it's something that's important because the metabolites secreted from yeast get into the brain and can cause damage. So you have to take it seriously and get it under control. Side effects of killing the yeast can often be something you have to be aware of. They can get tired. In some extreme cases, they may get a slight fever. They can get more stereotypical in their behaviors. You can see some increased hyperactivity. You can see some nausea, very rare, vomiting, and loose stools. Be aware that sometimes when you're killing yeast, they will get worse before they get better. Activated charcoal and Epsom salt baths are good at reducing the symptoms because it helps bind with those toxins that the dying yeast are releasing and bind them so that they don't harm or affect the child. So what did we see with him? We saw increased focus and concentration, less hyperactivity, better sleep patterns, increased vocalization and speech, so better socialization, reduced aggressive behavior, and stims, the stimulatory behavior, reduced. We also did chelation. I talked a little bit about that. We did a hair analysis. We saw levels of metals that we didn't like, even though it was probably not as bad as some. We knew that any of them were bad for him. We did what was called the Andy Cutler protocol. You can get information on that online. We did very low dose DMSA, which is FDA approved, used for lead toxicity with pediatricians for children who've been eating paint chips off the wall. We did 3 days on, 11 days off, and we gave lots of other supplements to support him, and we saw steady improvements. After we would do it on the weekends, and we'd skip a weekend, and we'd do it during the weekend. We saw improvements with him after each cycle. There are some natural, gentle options for detox. If you know your kid probably has high heavy metals, or you test for it and get it in the results, there's some very good, gentle types of detox that you can do to help your child's body start releasing these. I also did ABA. I believed ABA is the best thing for your kid, especially if you're doing biomed, because it works easier and faster. You don't need to do 40 hours of ABA when you're doing biomedical because it sticks. And they learn and they keep it and they generalize. We did a really good ABA program, and it helped him catch up. We started it when he was in preschool, and we worked on all the things that all his typical peers were doing, and he wasn't. And this would help him to become like the other kids faster. And you can use ABA for everything. Teaching them to potty train, social skills, play skills, academics, and helping them to learn the abstract things that they don't get easily because they're so concrete. And this was expensive, but you can find ways to do it less expensively. You don't have to do the 40 hours a week. You can hire students who are in special ed programs for less to come in and do the programs with them. I want to make a recommendation though, because not every ABA program is alike, and some ABA programs are better than others. And you want an ABA program that's fun and that your child is motivated in, that's not based on negatives and saying no. And you want an ABA program that will help your child's social skills. And James Partington is right out here. He has a booth on the corner. He has written a book for parents called Getting Started and Developing Critical Learning Skills for Children on the Spectrum. if you want your child to learn, the therapist can't do it. You have to be the therapist. You have to learn how to challenge their brain, how to help them interact with the world. And that's what I did with Daniel. I was a therapist 24/7. I took advantage of every opportunity that I was at to help him to engage with his environment, to respond to questions, to look at people, to look outside at the cows in the field, to talk to him about everything we were seeing in the grocery store. I did that, and this is the kind of ABA that teaches you, the parent, to do it with them as well, 24/7. And even if you can't afford ABA, you can learn how to do it and do it with your child. Because the more active you are in challenging that child's brain, neuronal pathways that aren't there can be created by you, by your interaction with your child. So the more you put into them, the more you know what to do, the more potential your child will have for becoming who he or she is meant to be. So there's a lot of other things out there besides what I talked about. There's hyperbaric oxygen therapy. They weren't doing that when I was dealing with Daniel. A lot of people are seeing benefits out there. There's, we did ionic foot baths. We had good results, if you've ever heard of that. That's kind of weird. You put your feet in and the water changes color. We saw good things with him. That was one of his last things that made him lose his IEP. Homeopathy, they're now doing essential oils that help the kids. There's so many different things out there, but you have to explore and you have to look and try with your child. You have to be a determined parent. You have to remember that this is going to take a long time. This is not a quick fix. It's not a pill you take and they get better. It's a whole different dynamic, unfortunately, than our fast food society is used to. Continually research, new treatments, internet, conferences. Successes will vary. Not all kids will recover, but many will see improvements. It's stressful as a parent to do this, so make sure you take time to care for yourself. Take supplements yourself, get away, get some respite, because, you know, as we all know, the old adage, nobody's doing good if mama's not doing good, right? So, and again, this can be for dads too, because a lot of dads carry the load as well. So you have to take care of yourself too and make time for yourself. Otherwise, it will be too difficult to do. And I want to end with this before I introduce Daniel. The TAC theory, and this is really important. Every child has different TACs, and each TAC represents an issue that they have, okay? And the issue could be yeast, the issue could be food allergy, the issue could be a viral issue, the issue could be a bad type of bacteria, different things that are going on that are contributing to your kid's autism, okay? So if you were sitting on 5 TACs and you removed 1 TAC, how much relief would you feel? Very little, wouldn't you? Okay? So some of these kids that are harder have more TACs. So if I start with the diet and I don't see big wows, and I stop the diet because I don't see big wow, does that mean the diet is not necessarily helping my child or supplements? It just might mean that there's some more TACs there that you've got to locate and you've got to get rid of. So you have to understand that you know, Daniel's main TAC was the diet. He still had some minor TACs. I removed the diet TAC and I saw big things, but there were still issues there and there were still other TACs to get rid of. So we have to be careful to acknowledge that just because you don't see huge wows, the reason may be that there's another big issue that you've got to find. And once you get that issue gone, you'll see the benefits of all the treatments that you're doing come to flourish. There's reason for hope. This is Daniel at 18 months. 6 months into intervention, we see a totally different child here. Engaged, happy, and he's got a puppy that he loved very much on his stomach. So you get started by you make changes in the diet, you start adding supplements, you get testing done, find a doctor who's been trained to help you along the way, educate yourself, be determined, and have hope. And don't be overwhelmed, one day at a time. If you can't do all the things at once, start with one thing and give yourself permission to do it slow and go slow. You're doing something. And because being overwhelmed is the main reason why parents will shut down and say, I can't do this. This is too hard. Start with something and go slow and give yourself permission. My baby, not my baby anymore, but he always will be my baby. He's 11th grade, junior year. He plays in the marching band drum line. He's getting ready to get his driver's license. He has friends. He interacts appropriately with peers. He has a great sense of humor, always makes me laugh. He's a loving child, shows empathy and compassion, academically advanced. He gets straight A's except when he gets lazy. Eats normal diets. He eats a normal diet after 9 years of being on the diet. That wasn't my choice. That was his. He was sneaky. And then he goes, see, Mom, nothing's wrong with me. I'm fine. And I'm like, oh, but he was. He was. So he was one of those ones that could go off the diet. So, it's good for him. Takes very few supplements now. Used to take a ton. And I think it's post-traumatic stress disorder is what I think it is. And he plays way too many video games. Right, Daniel? Let's meet Daniel. Will you give Daniel a big welcome? I'm so proud of him for being willing to do this. I love this kid. He's my heart, my life. He's changed my life. I'm a different person. What I do for my living, everything, the way I think about the world has changed because of him. And not everybody can become a Daniel, but Daniel is an amazing kid. And one of the things, I'm going to put my information for contact. Please feel free to email me if you want to ask any questions. If there's anything I can do to help you in any way, I'm more than happy to do that, okay? Because I have a mother's heart, and my goal is to help everyone along their pathway and get as much help for your kids as possible. So, Daniel, I'm going to ask him a question first. And again, this is off the top cuff. I've not even told him what I'm going to ask him. I'm going to ask him a question, and then I'm going to allow you guys to ask him questions if you want to, okay? What is the main feeling that you have after watching me give my presentation and seeing how far you come and what you were like and where you are now? What comes to your mind, and what do you think about the fact that you once had autism and that you don't have autism anymore?
I don't know. It was such a long time ago. It almost feels like it wasn't even me. It was like a different person. I don't remember. I don't remember being that kid anymore. I feel like such a normal situation and personality that like the fact that I see that was me at one point almost like blows my mind, because I was like that, like I can't even remember that being me. It's just like, wow, it's really not good at talking.
No, you're doing fine, sweetie. You're doing fine. Yeah. I put a lot of pressure on you. What do you remember about the diet and the supplements and how that made you feel?
I remember taking way too many pills. Like, she would have individual bags for every single meal, and it was like I remember constantly pills getting stuck in my throat and like trying to avoid them. I remember when I was young, I tried to like fool her, try like to hide the pills somewhere, to like throw them away so she doesn't see them. And I'm like, I don't need them, I'm okay. But yeah, but it was I from personality, like I never felt anything. I apparently it's more from other people that can see my differences. If I act like strangely, like I couldn't tell anything wrong, but she could definitely see something wrong.
Does anybody out there have a question for Daniel? Go ahead.
I'm almost afraid to ask this question.
Don't.
Feel free to say no.
Okay.
I have a little boy who was just diagnosed, and my fear is bullying. Did people pick on you? Were they mean to you?
No. by nature, I'm pretty shy, and what I like to do is if I'm in a situation where I don't feel comfortable around the people that I am, I usually just like kind of like I try like to stay quiet or like blend in with my surroundings. Like basically, if they don't see anything noticeable about me, there's nothing that they can make fun of me of. So that's how that's how I got through school pretty easily. But by the time I got to middle school where that stuff is very important, I was pretty much fine. So I didn't really need that much help in that area anyway. So that's just me.
Anybody else? Yes. Stimming. Yeah, I'm sure what this stimming is. Daniel, he never was a hand flapper. He never did that. He had eye stems. At one point, he would take a spit and he would draw on the remember the glass? You'd go into a glass and you would rub spit and smear. His stimmings were related to his eye. And then he had another thing that I used to drive me crazy. And he would play with his fingers and he would do stuff like this. And when he got to the point where he was as good as he was, we'd have conversations with that. And I said, Daniel, you don't do that. That looks weird. And what would you tell me?
Whatever, Mom. You understand.
They don't know.
Do you ever have that urge now to do that?
Be honest.
Not actually not that much, and not at all anymore, really. Usually when I was younger, it didn't seem that much important to me. It was just like if I was bored, like I would think of something in my head, and then I would try. I'd act it out just to see if it was like if I could make it look cool, and then like the fingers were more of a visual effect more than like me just being weird. It may look weird to other people, but I thought in my mind it looked cool. So
Good answer. Anybody else? Right. Yeah. Yeah. No, I mean, I just, that always just kind of blew me away because people would have a child with autism and my child was like getting normal and their child was still severe, and I would give them a book and go, "Jill, what are you doing with Daniel? He's doing so great." And I would show them and they would read it and they still would not do it. And I never understood that, you know. I was always this mom that was just talking to the teachers, you know, it's got to be in that. There's another thing. If you do diet, put it in the IEP, okay? If it's not in the IEP, they won't pay attention. So if you've got an IEP and you start this, you go back and go, I need to put this in the IEP. Let's call a meeting. It's got to happen. That has to happen. Otherwise, there's going to be all sorts of problems and your kid's going to be getting stuff they shouldn't get. Teachers are not going to take it seriously. So when I'm real serious about it, the people around me are more serious about it. And so I would just tell Mom, Daniel can't have that. Or, you know, if there was a birthday party, I would bring it. I'd say, when you serve pizza, could you please put his pizza in the oven? I mean, I just went out of my way so he wasn't not eating or he was going to be tempted to eat something else. Supplements were kind of done at home. You know, if anybody saw me putting that amount of pills in my body, they'd go, what? You know, but they helped him. They really were good, but it was an enormous amount at one point when he was worse. The good thing about it is you start reducing the amount of pills along the way. But I think just my intensity of importance of it, and they just were more serious. I don't remember getting to my face people, you know, challenging me. They may have talked about me behind my back. I'm sure that did happen. But, you know, I didn't care. I was getting my kid well, and that was all that mattered. I was a mama bear, mama tiger, and cross with me, you know, you have to deal with me. So anyway, that was kind of the way I did it. But it was just, I just knew that I was helping him, and I was going to follow that pathway and do whatever I could to get him well, no matter how strange or weird it sounded. And I was willing to try everything, including weird things like foot baths or energy healing modalities or anything. I was willing to look at anything that I heard another parent was getting benefit from. I looked at it, I tried it. And as I said, I was the therapist all the time with him, constantly challenging that brain of his to open up and think. And I really think that's why he's as good as he is today. You see the sense of humor, you see the creativity, you see all of that. And I believe that the more you put into it, the more you get out of it, for the most part. Yes?
For the youth overgrowth, so your checklist is my son, verbatim.
Yeah.
So we have the school near analysis. They came back with they didn't get home with youth level. Is there a more accurate way to test, or is stool the most accurate way?
Well, no, stool can be problematic sometimes. It depends on the IgA levels. Sometimes they can't culture your child's yeast or bacteria because they only allow so much time in the lab. And if they don't get the growth in that amount of time, they say it's zero. So there's a lot of times where you test for the stool and it comes out normal, but then you do organic acids, which look at the metabolites from it. Organic acid tests will show the metabolites from the yeast and metabolites from some of the bacteria. So if you see organic acid levels high, then you go with that. And if you can get it from the stool, it gives you more information, but doing both gives you all the information you need to make sure that if it's just not cultivating in the lab. Mm-hmm. Yes, go ahead. There were some times along the way where he would get something and he'd have a stomach ache. I think honestly the issue was that he was on it so long that eventually his gut healed, and that's what it's all about, healing the gut. And once the gut is healed, the yeast is gone, there's no more food escaping through the intestinal tract, he stopped reacting. And I didn't believe it, and I'd be shoving enzymes. Okay, I'll let you cheat this one time. You take enzymes to help with the reaction. And he would take them, but then eventually he'd go, no, I didn't take my enzyme, and I was fine. You know what I'm saying? And I just kind of went, yeah, but you still have to. You remember me doing that? And he would hide the pills, and the lunch lady called me one day. Daniel throws away his pills every day at school. I just want to let you know, you know? And he's like, how did you find out? So you can get that. And I just eventually gave up, and I accepted the fact that he's okay. But I mean, early on, I think in the first 4 years or so, it would not have been that way. The fact that I stuck with it 100% for as long as I did, I think has allowed us to be able to get to the point where he doesn't have to do it anymore. But it can be a long process. Yes? Okay. Yes, he is very. Say thank you.
Thanks.
You answer the question. Do you like school?
Sports. Actually, I'm not very much of a sports player. I don't know. So just active. I don't like. I'm like one of those people. I don't like getting hurt that much. Yeah, like if I'm in a situation where like I could get hurt, but I could not do that and not get hurt, and I could just stay home and be safe, and I'm like, all right, let's go with that one. But yeah.
I just wanted to add one more thing. He was really low tone, and he had major gross and fine motor issues. And I honestly believe that had a part in the fact that he never became athletic. I think it's just one of the carryovers. And, you know, I'm not from an athletic family, and his biological father is not either. So I think there's genetics involved in that as well. And he doesn't like school, by the way. All right, one more question, and then we have to go. Thank you. Thank you very much. Thank you. Thank you.
You should answer her question too.
What was- Anyway, I just thank you so much. This was my pleasure, and I love doing this, and I hope I've encouraged you, and I hope I've given you some ideas and hope to help your child, because there's so much hope out there, and there's so much that can be done. And thank you so much for this opportunity and for coming to here. God bless you all.